When disease or trauma results in the loss of more than one tooth, an implant-supported bridge can offer an excellent solution to fill in the gaps that were left by the missing teeth. A large gap caused by several missing teeth can cause difficulty while chewing. And place unnecessary pressure on your remaining set of teeth. Receiving an implant-supported bridge requires several dental appointments that first involves the placement of implants on the jawbone. After several months of allowing the gum and bone to heal over the implant, your follow-up appointment involves the creation of the permanent bridge using impression copings. An impression of your jaw is then taken and then sent to a dental lab. After the impression is taken, the impression copings are removed and replaced with healing caps, which are left on for 2 weeks to allow for the healing process. During your final appointment, abutments are inserted on top of the implants as the permanent bridge is cemented into place.